So today we have discussed about the mandible bone. So mandible has two parts. One is the ramus and the one is the body part. Okay. One is the this is ramus and this is the body part. So body has two surface. One is the external surface. This is the external surface and this is the internal surface. This is the internal surface, external surface and the internal surface, and two border, alveolar border, and this is the inferior border or base. Ramus is the mainly quadrilateral part, and it has two border. It has two surfaces. One is lateral surface and other is the medial surface, and four borders. This is the anterior border, this is the superior border, which is actually the mandibular notch, and this is posterior border. This is posterior border and this is the inferior border. Okay, this is the inferior border. So now we discussed about the body of the mandible. Okay. Body of the mandible. So here we see that this is an elevation. Here this is an actually elevation. This is known as the mental protuberance, and this is known as the symphysis menti. At the age of 2 years, two mandibular ossification completed at this position. This is known as symphysis menti, and this is known as mandibular protuberance, mental protuberance. And this mental protuberance on each the side, in either the sides, it continues as the mental tubercle. This is the mental tubercle. This is the mental protuberance. Okay. Now, below the incisor teeth and above the mental tubercle, here is a fossa, it's known as incisive fossa. This is the known as incisive fossa, and this is a foramen. On each the side. This is a foramen. This is known as the mental foramen. Okay, this is known as the mental foramen. And from the mental tubercle, actually here is a line, is called oblique line. It is from the anterior border of the ramus, anterior border of the ramus, and continues downwards and forwards to the mental tubercle. This is the oblique line. Okay, and this is the alveolar part. We got it. This is the alveolar part and this is the base. External surface is done. Now the internal surface. Now if we see the internal surface, here is the symphysis menti, and below this we see that it is a tubercle or spine is present. Here is the genial tubercle or spine, we can see it, and here we see a line, that is the mylohyoid line. We can see a groove just below the mylohyoid line, and mylohyoid line is actually from the behind the last molar teeth, and downwards and forwards and up to the below the genial tubercle. This is the mylohyoid line, and this groove is known as the mylohyoid groove. We can see that this is the mylohyoid line, and below it this is the mylohyoid groove, and the mylohyoid groove is the posterior end of the mylohyoid line, and below this this is the submandibular fossa, and above the mylohyoid line it is the sublingual fossa. Okay, and here is the anterior part of the mandible. Here is the anterior part of the mandible. We can see two another fossa. This is known as the digastric fossa. This is known as the digastric fossa. So our external surface and internal surface of the bone is body is covered. Now we see the ramus part. So ramus part, before we discuss about the borders and surfaces, now we see the part. This is the coronoid process. This is the condylar process. Coronoid process is triangular flat elevation, and this is the condylar process, elliptical horizontal process. This is called the mandibular. This is called as the mandibular angle. It is actually the junction of inferior border and posterior border of the ramus of the mandible. Okay. Now we see some rough elevation is present in the outer surface of the rami. This is for the masseter muscles attachment. We see some bony ridges in the inner surface of the rami, and here is a foramen is present. This is known as mandibular foramen, and here behind the mylohyoid line we can appreciate a canal which opens through the mental foramen. Here the mandibular canal is present, mandibular foramen to mental foramen. Okay, and this elevation in front of the mandibular foramen is known as the lingula. And this is the mylohyoid group. We see it before, and this is the condylar process, which is this is the head, this is the neck, this is the neck. You can see it. This is the neck part. This is the neck part, and here you can see a fossa. This is the pterygomyloid fossa. So till now we discuss about the parts of the mandible bone. Now I can say the attachments of the bones. Now we can see the attachments of the so here is the mental foramen. So the mental foramen is there. Here is the mental vessels and nerves present. Now if we consider the base of the mandible, so it gives attachment to the deep cervical fossa. Yes, and above it or superficial to the deep cervical fossa, platysma is present and deep cervical fossa. And here is the oblique line. So this oblique line, behind posterior end of the oblique line is present the buccinator muscles, and inside it here is the pterygomyloid raphe is present. Okay, pterygomyeloid raphe or ligament is the present this position where the mylohyoid groove end of the mylohyoid groove near about, and here is the attachment of the superior constrictor muscles, and here from here this is the pterygomyeloid raphe. Pterygomyeloid raphe. Here the mylohyoid line, so here the mylohyoid muscles is present, and at the groove the mylohyoid vessels and nerves is present, and the sublingual fossa here it lodges the sublingual gland. Here is the submandibular gland, and we see the genial we see the genial tubercle. So it is consists of two pairs above and two pairs below. Two pairs above and two pairs below. From above it is the genioglossus muscles attachment, and here is the geniohyoid muscles attachment. Here is the geniohyoid muscles attachment. Here is the geniohyoid muscles attachment, and here is the genioglossus muscles ligament, genioglossus muscles attachment. Here is the digastric fossa. So this is the attachment of the anterior belly of the digastric muscles. Now we can see here is some bony ridges. It is for the medial pterygoid muscles. Here you can appreciate it. Here the medial pterygoid muscles, and we pterygomyeloid phobia. From here the lateral pterygoid muscles is present, and from the anterior border, inside the anterior border of the coronoid process, it is the temporalis muscles. So here the auriculotemporal nerve is present, and auriculotemporal nerve, and you can appreciate some ligaments. Here is this mandibular ligament, we see it, and pterygomandibular ligament, we see this, and the two ligaments are remaining. So one is the temporomandibular ligament, that is present the lateral aspect of the neck of the mandible. So here is the here is the temporomandibular ligament. Okay, here is the temporomandibular ligament. Okay, and temporo done, and spinal, and one is left, and that is the stylomandibular ligament. This is attached with the mandibular angle. Okay, so ligament done, and nerve almost done. Auriculotemporal nerve is here, and inferior alveolar nerve, and and one is remaining, that is the marginal mandibular nerve, that is present around the base. Okay, that is the marginal mandibular nerve. Okay, so nerve, blood vessels, you can see that mylohyoid vessels, inferior alveolar vessels, and that's it, and this we can appreciate it. So we completed the mandibular bone, mandible. We can complete the mandible. So please like, share and comment if you want more such video. So please subscribe this channel. Thank you.